I think one of the reasons why I like triage so much is because people come in for the exact same reasons. Every once in a while, you'll get like surprise, and most labor nurses like a little adrenaline, so you kind of, feed that. And but for the most part, people come in for the exact same thing. And education is a big part of triage, so I think that's one reason why I like triage so much. Anytime I teach prenatal classes, we always talk about, well, why should you go to triage? The majority of people who are triaged do not get admitted. So I'm just going to go over a few of the common reasons people come in. And, but if you are ever concerned, call your provider or go to triage to be assessed. One of the main reasons, one of the frequent reasons why people come to triage is for bleeding or for, I think my water broke. And there's a good rule of thumb for both of these. Anytime anyone comes to triage and they say, I'm bleeding, I say, do you have a pad on? And if they say no, I kind of go, because that's a good sign. If a patient, if I say, are you bleeding? And the patient says, well, I have a baby blanket down there, but nothing's stopping it. Well, then that's not a good sign. And then we all kind of scramble to, to intervene as quickly as possible. One of the most frequent things that I hear is, oh, I'm bleeding when I wipe. And so something that I think that every pregnant person needs to know is that your cervix is very vascular, and I always say it's like a tunnel. I only have a Diet Coke here, so I'm going to use this. And so if it's like this, and this is the tunnel, this is very vascular. So if anything touches this, you may have a little bit of bleeding. And by anything touching it, I mean if you're, having sex, or if you stick anything in there, or if you have a vaginal exam. Any of these things that kind of like mess with your cervix, you may have a little bit of bleeding. And that's frequently what I will hear is, oh, I'm bleeding when I wipe, or, oh, I bled a little bit when I wiped. And that is usually, not a horrible thing. It's, you'd still want to get checked out if you're concerned about it, but that's usually an okay thing. If you're having to put on a pad because it's like a period, that is not a good thing. And then you should definitely go to triage to be assessed or call your provider. The same rule of thumb goes for, I think my water broke. So anyone who says that they think that their water broke, I always say, do you have a pad on? And if they say no, then I usually think their water probably isn't broken. As a nurse, we'll still assess and, and check to see if your water broke. But, who likes to wear panties that are wet and just walk around in them? No one. So, when your water breaks, it doesn't usually just stop. Usually it keeps coming, and there's nothing you can do to stop it. It will keep coming until your baby is born. Now, there are a couple of instances where you may just have like a little trickle of water, but typically speaking, it will keep coming and you will have to put a pad on. If you do have just a little bit of water, one reason why you may just have like a little trickle is the baby's head is pressed really hard against your cervix. And so, you can get up and like try to change positions. And if the the baby's head may kind of move a little bit and you may feel more water come out. But either way, typically speaking, you have to put on a pad. If you're concerned, call your provider or go to triage to be assessed. Frequently I'll hear people say, oh, I felt this ping down there, and all of a sudden I was wet. And I mean, it's like I have ESP. You peed on yourself. Probably. You probably peed on yourself. And a lot of times is what happens is when you go all night without going to the bathroom, your bladder gets full and you'll have like a little bladder spasm. And so people will always say, ooh, I got this pain, and then all of a sudden I was wet. And they always say the same thing. Well, it didn't smell like pee. It didn't look like pee. But then we, check it out, and it's pee. But don't worry, it happens to pregnant and non-pregnant people, but especially to pregnant people. But if you're concerned, definitely call your provider or go to triage to be assessed. So this is part 1 of reasons to go to triage.